updates. Benue State is on the roadmap to domestication of Mental Health Act. Experts Thursday gathered at Bureau for International Cooperation and Development, rubbing minds on steps for the domestication and implementation of the Mental Health Act in the state. Correspondent Mhei was there and now reports.
According to experts, mental well-being is crucial to survival of the society. In view of this, representatives from civil society organizations, non-governmental organizations and government agencies are here rubbing minds to chart a way forward for effective domestication and implementation of Mental Health Act in the state. Benue State Commissioner for Health and Human Services, represented by an officer from the ministry, Teokase Nguswen, expressing readiness of the ministry to ensure effective implementation of the Mental Health Act in the state.
The ministry is positioned to carry out a lot of things. We have had series of trainings in mental health, especially trying to put mental health at the primary health care centers throughout the state. We were sponsored through the government and the Australian AIDS with a pet project called Comprehensive Community Mental Health.
Director General, Bureau for International Cooperation and Development, Dr. Leonard Aondosia, and Special Advisor to the Governor on Persons Living with Disabilities, Ben Bartolome, affirmed the readiness of Benue State government towards these objectives.
On the government side, we are fully attending. What we expect to improve on is the participation of mental health actors among the development and humanitarian partners. They need to sit down in one room.
The government sector has mandated the Bureau for International Cooperation and Development to coordinate all activities of NGOs and NGOs. So for a process like this that is facilitated by NGOs, I would suggest that a coordination meeting be called so that all stakeholders will be brought on board to also look at this and see where everybody needs to come in. I think that is where the implementation should start before it gets down to schools, down to health facilities and all of that. The relevant stakeholders we call, including traditional and religious institutions. So you can, when we draw them on board and then present this to them, they own it, and then the process of implementation becomes very easy.
Founder Mental Health Empowerment Initiative, Mhei Abba, gives condition for effective implementation of the Act as collaboration with the security agencies, traditional rulers, and enlightenment of the populace.
We had over 12 stakeholders. Is to say that we must all be involved, right? The issue of mental health is everybody's business. In that the well-being of the average or the least Benue citizen is not just only to himself or to the community or to his family. It is a national asset. The mental well-being of an average person in this state is an asset for national growth, national security, and national development.
According to a source from the Benue State House of Assembly, the bill for domestication of mental health in the state has passed second reading on the floor of Benue State House of Assembly. Attention has turned towards domestication and implementation of Mental Health Act, improvement of Nigeria's overall well-being in official capacity, which is needed to provide adequate care and support for the people. Matthew Ikulono, Benue Television News.